in our presenter list. So yeah, thank you everyone for joining us. It's lovely to have you here tonight. My name's Katie Pryor. I'm the Senior Manager of Primary Care Development and Training at the Western New South Wales PHN. And I'm really pleased to be here tonight working with a wonderful team from eHealth New South Wales, HealthLink and the Western New South Wales Local Health District to bring you this webinar on electronic referrals, which is rolling out for the Dubbo outpatients next week. Before we get started and I pass over to the team, I'd just like to run through a little bit of housekeeping. Tonight's webinar is being recorded, so if you have colleagues that have missed it or if you need to check back in on any information, we'll make that recording available on our website and you can always request it from the team. Everyone will be on mute for the session. That's really just to optimise the sound quality for the recording, but we really welcome your questions and your input. So please use the Q&A box down the bottom or the chat, and we will address all the questions that come through either throughout the presentation or at the end of the presentation. So as I mentioned, tonight's webinar is on the new e-referral system that is launching next week in Dubbo. And I'll now pass you over to Craig Shields, who is the Manager of Value and Service Provision at Western New South Wales Health District, to introduce you to the team and get us started. Thank you so much, Craig.
So firstly, can I just say thank you to the PHN for having us along this evening to present on e-referrals or engage outpatients. There are going to be a number of presenters this evening, both from the local health district and also from eHealth. The presenters are up on the screen in front of you now, as well as the topics that they will be presenting on. Can I just say that unfortunately Dr. Ivy Chua is unable to join us this evening. She is an apology. So we will endeavour to try and use the whole panel that we have to try and answer any questions that might arise from any of the demonstration talking points that Dr. Chua may have wanted to speak to this evening. So firstly, without further ado, what I would like to do is to take this opportunity to acknowledge the country that we live and work on. The Western New South Wales Local Health District respectfully acknowledges the traditional owners of the country throughout Western New South Wales and their continuing connection to land, water and community. We pay our respect to traditional custodians, our elders both past and present, and we also acknowledge the Aboriginal people of the nations that we have the privilege to live and work on. We share and celebrate the rich history of Aboriginal culture, and we recognise the diverse and proud Aboriginal nations across our district. And we would also like to acknowledge to those who are joining today's session on lands outside of the Western New South Wales Local Health District. And finally, I'd also like to recognise and welcome anyone joining the meeting this evening who identifies as either Aboriginal or Torres Strait Islander. So firstly, this evening, I'm just going to provide a quick overview of the Engage Outpatients project. Engage Outpatients is a statewide program that enables local health district outpatient clinics to accept electronic referrals, or also known as e-referrals. So this evening you will no doubt hear the term Engage Outpatients, you'll hear the term electronic referrals and e-referrals. And I think it's fair to say that these terms this evening will be used interchangeably throughout the presentations. As previously mentioned, Engage Outpatients is a statewide program, and it's already been implemented across many local health districts across New South Wales. The reason New South Wales Health was keen to develop and implement this solution is Due to the lack of a standard approach across outpatient clinics, especially in the way that we receive referrals. And that is very much the case with our clinics across Western New South Wales Local Health District. Many of our clinics still rely on paper-based processes, including fax, post, and even unsecure email. So therefore, we want to, where possible, standardise the way our clinics operate. And referral management and e-referrals is a large part of that standardisation. And we know that this will have a really big impact on the experience of referrers and also the generalised efficiency of our clinics. So in a nutshell, when established, e-referrals will allow GPs and other referrers to efficiently and securely send referral documents electronically. I'm going to hand over to Joss Barber from Dubbo in a few moments. Joss is going to talk specifically about the e-referrals project at Dubbo Health Service. Dubbo is the only site where we are implementing this project at this stage, and we're also only doing it with our medical specialist clinics. However, we do have the intention to expand e-referrals across other types of clinics and across other locations within the local health district. We don't have a time frame for that yet. However, there is a lot of interest from our clinicians in other sites around implementing e-referrals. And this evening, we also have our colleagues and team from eHealth in attendance. They will outline in more detail how the system works. However, I just want to acknowledge that eHealth has partnered with New South Wales Health, local health districts, and also HealthLink to bring about this program. So without further ado, I'll hand over to Joss. And can I just make a shout out to the rest of the presenters that when you want the slides changed, please just let me know and I'll move us on to the next slide. So Joss, over to you.
Thanks, Craig. Dubbo Health Services very fortunate to be offered the opportunity to roll out electronic referrals for our specialist clinics. Although it's an accelerated rollout, as you can see with the discussions and planning in July, we have had access to experienced eHealth, HealthLink, PHN, Health Pathways, RDN teams, and Dubbo Health Service staff have been very busy throughout August, undertaking internal and external promotion, building forms, setting up and testing the programs, and collating resources. Throughout this week and next, we're undertaking intensive training and further communications ready for go live on the 11th of September and throughout the subsequent monitoring support period. Thanks, Craig. The next slide outlines the Dubbo specialist clinics for which e-referrals will be available. Most of these clinics are located at Ambulatory Care Centre and include Medical Day Treatment Procedures Clinic. Paediatrics, Diabetes and Endocrinology are located at Betty Orth Building. Obstetrics up at Maternity and Rehabilitation at Wallan Maratona Green Place are included, as is Geriatric Medicine, which is off-site and predominantly delivered via telehealth with some face-to-face clinics. Some of these specialist services include subclinics, such as stroke under neurology, liver under gastroenterology, and ortho subclinics for hand, shoulder, knee, foot, back, and fracture, all under orthopedics, although screening in that instance would skim out any fracture referrals for more immediate triaging and bookings. Urgent emergency referrals should default to usual management in terms of ED presentation and discussion with appropriate on-call clinician for advice as per current process. So even though we will accept faxed and email referral during the transitional phase, as of the 11th of September, the preferred method of submission of referrals for these Dubbo specialist clinics will be via electronic referral. I'll hand over to the eHealth team for further end-to-end overview of the electronic referral pathway.
Thanks, Joss. and it's wonderful to be here tonight and have the opportunity on behalf of some of the health team to provide an overview of this solution. So many of you will be familiar with the HealthLink forms through the driver referral programs for assessment and also in the aged care. But what happens is in your practice management system, and HealthLink's well represented as Practice Medical Director, Jeannie, and many others, you'll call up a form. And what I'm trying to show you here is a picture of what the overall solution looks like and how it gets through the process. So when you enter a referral, you call up the form. It links to all of your clinical information in that system. So it brings across all the patient information for you that you need, and you can add to that. The referral is securely sent through HealthLink and arrives in what we call the ERMS, or Referral Management System. It then goes through several stages in that, and during this process, both yourself and the patient are kept informed. So as soon as it's received by the system, you will be notified. And then when it's actually triaged, you'll also be notified. And in between that, the service can send you individual messages, so that allows them and yourself to communicate backwards and forwards and provide additional information or updates on where things are at. The final part of the process is that then gets automatically loaded into the EMR, so that saves time and effort in medical records and accuracy and a whole lot of other things that people do. So hopefully that provides you with some sort of sense of it. You'll get to see the forms later on in the webinar. If we can go to the next slide, please. Some of the benefits, I'm not going to read this out, but some of the really important things are those things that I've just spoken about communicating with your practice and with yourselves, eliminating some of those manual processes by automating the load of the information, making sure that the communication is pretty much instant. So if the triage clinician needs to know or wants to get more information from you, they can send you a message instantly. And also the pathways that support those referral criteria are also embedded within the form. So what you might see if you refer a cardiology patient would probably be very different to what you might see for other types of patients. No doubt, as you start to use the system, you'll see some of these benefits. And I'd now like to take you very quickly to the adoption rates. So the next slide, please. We've seen a significant growth over the last 12 months in particular as we've rolled out. And I've had the pleasure of leading several of those implementations, including into Far West, which is a wonderful experience, as is the one in Western New South Wales, where the needs of rural in a rural setting for patients in the setting, fly in, fly out type of clinicians, etc., are very different to what we might meet in a metro environment. So it's been a pleasure to do that and do it again. But the results are self-evident there. As you can see, over the 12 months, it's exponential. And it's a sort of graph that people like to see when you're talking month to month. And we expect that to continue as we go across this domain. And then, of course, the others continue to expand into the future. My last slide is having the pleasure to talk about the sort of the feedbacks, and the eHealth team very often sits behind the scenes, and it's been a real pleasure to be part of the team, to actually be in the hospitals and meeting the clinicians, meeting the people at the front end, the administration people who deal with patients every single day, and then listening to their feedback. And again, I'm not going to read this, but there's been overwhelming adoption and very positive feedback from both the clinicians doing triaging and also doctors sending the referrals, which is obviously why we're here tonight. And then of the administration people as well, who spend their days liaising between yourselves and the clinicians doing triaging to get the patients seeing the right care in the outpatient setting. So I think that's it from me, and I'll now hand over to HealthLink and the demonstration from the eHealth team on the HealthLink forms.
Good evening, everyone. So my name is Madhu, and I will be doing a quick demonstration of launching a form from HealthLink application. So I will share my screen. So as you can see, I have logged into best practice GP software. So I've opened a test patient here. So what I'll be doing today is I will be launching the forms, HealthLink forms. To launch the HealthLink forms, there is a HL option here menu where you can click the HealthLink. So this will integrate and launch the available HealthLink forms. And like this is a test system, that's the reason I'm able to see multiple LHDs, but if it's Western Sydney, you will be able to see Western New South Wales LHD here. So once you click that one, so before you click that one, there are two options here, one to make a referral and one to update a referral. Make a referral is an option where a doctor is sending a brand new referral. An update referral is, for example, if any of the reports which are like if the doctor has forgot to attach or something like, or any other scenario where if the patient condition has been improved or if the referral is not needed or the patient condition has deteriorated and they wanted to send increase the priority of the referral, they could send the update referral. So that's this option here. So now I will be submitting a referral from Western New South Wales. So once I click the Western New South Wales, as Joss mentioned, you will be able to see all the clinics which are currently going live. So these are all the services which are available and going live on 11th of September. So I will be submitting a cardiology clinic referral today. So once I select the clinic, you will be able to see all the facilities where you could send a referral. So currently here, the Dubbo based hospital is the first one, first hospital which is going live. So you can see Dubbo based hospital here. If there are more hospitals going live, there is an opportunity for you to select the drop down and select the particular hospital there. So I've selected, as you can see, the hospital is auto-populated there, and just click continue. So this will launch the cardiology specialty form for the patient, to submit. So there are multiple specialist forms. So as you can see, this is the cardiology specialist form. If at all a referral needs to be submitted to a specific referrer, then the referrer can be selected here. Currently, it's a test environment. That's the reason there are no practitioners available. If there are available, you should be able to select the specific practitioner. But now I'm submitting the unnamed referral. And then some of these fields are auto-populated, and any mandatory fields on the UI will be shown with the red asterisk there. So the referral type is automatically selected as new. If at all GP wants to send a sub-continuation referral, they could select the continuation here. There is a red message here which is showing, because this is a brand new referral sent. If at all a user wants to send an update referral, this is an information message for the user to submit an update instead of brand new referral. And the referral period is automatically populated to 12 months if at all it's needed. Like if they want the referral period to be only 3 months, they can select the referral period as 3 months, or if it's indefinite, they could select the indefinite option here. And the referral priority is automatically populated to non-urgent. If at all, if the patient condition is not good, then they could select the urgency of the referral to be 30 days or semi-urgent or rapid access. So that's the referral priority which can be selected depending on the patient condition. And the patient available for appointment for the short notice. So as you can see, these are auto-populated. Again, these can be selected depending on the patient's appointment short notice. Is the patient suitable for virtual care? Again, if it's unsure, they can select unsure. If it's yes and no, the doctor should be able to select the right option. So I will be selecting no for today. And again, the third party compensable here. If it's no, you don't need to select an option. If it's yes, there will be a conditional drop down which will be shown to the user to select. So it's workers' compensation or the motor accident injury city decline. So these are, some of them are logical as well. So it's depending on the question you selected, the sections will be auto-populated. And in here, the reason for referral, as you can see, there is, because this is the cardiology, this is specific to the cardiology condition where user should be able to select. And once these conditions are like reason for referrals are selected, the supportive documents which are needed for this particular reason for referral will be automatically populated here, so that it helps users to submit what's needed. And there is also help pathway links, which also helps the user to know more information about how to submit the referral here. And moving to the next section here, have you included all the referral information? This is also mandatory. I will select yes. And referral details here, browse. So these referral details can be populated by entering the text here, or if there are any.
Matu, sorry to interject. There's just someone in the chat has said this. The screen's quite small. Is it possible to zoom in any way? Perfect. Thank you.
Sorry, I didn't check the chat message. Adam, if there is anything, could you please prompt me again?
Absolutely.
Thank you so much. And the next section is the browse for the consultation notes. Again, so this one is the free text field where the data can be populated here, or else they could be browsed here. And if there is anything here which needed to be attached, could be selected, ticked or unticked. If at all anything not needed to be added, then user don't need to select it there. I will select this one here. And as soon as I click attach, you should be able to see the details populated automatically. And also there is additional referral information. There is an information icon here. Once you click that one, it will let you know what to, like, it will help you out to enter what's needed in the additional information, if at all something additional information needed to be submitted. I believe it's not a mandatory field, so I'll leave it for now. And here, does the patient have the primary care guardian? Again, these are logical fields again. So once I select the yes, you will see the options to populate the carer details and the preferred method of contact as well. So depending on the preferred method of contact, the SMS notifications and the email notification from the ERMS will be sent accordingly. I will just populate some test details here. So it's a carer, and who is the primary contact for this referral? I will put it as carer. And interpreter required as well here. If I select yes, the conditional version will populate again. So ERMS supports about 10 languages where communication messages can be sent as per the preferred language of the patient. So I'll just select Vietnamese here. So that whatever the notification going out from the ERMS will be sent as per, like in Vietnamese, both SMS and email. And special needs can also be populated here. Once you select, there is a text box comes up where you could enter the special needs here. So you just enter the description here. And are there any condition risk barriers? Again, yes, you need to populate those information here. If not, just select no. And patient consent is a mandatory field. Once you select any of these fields are not populated, mandatory fields, you will see the message coming up on the top to indicate the user to submit. These red, like these boxes here, indicate that there are some additional information which is not being populated. So requested information is a main section for submitting the referral, and the rest of the sections I'll just quickly go through. For example, if at all the user needs to submit any attachments, supporting information documents, this is where all the attachments and reports will be available. Either they can be browsed if any patient documents are available, or if at all any additional documents needs to be submitted from the system, they could browse from the local file and submit. So for now, I'll just submit an incoming letter here. If again, these ones are, the user can select or unselect whichever they wanted to submit for the specific referral. I'll just do a browse for the patient documents if there are any available. So once I search, you should be able to see, these are some of the test referrals which were submitted before. So you would see those ones as well. So if at all you wanted to send any previous referral, it can be sent again. So I will be selecting a couple of attachments from the patient documents here, which will be available here as you can see. So these are the selected attachments which will, and user will know that there are 2 reports attached here. So I'll go to medications and allergies. Again, this section again, where you can send the information and you don't need to send the information if at all any of the long-term medications or any medications which are not active and they're still available on a patient record. If at all they wanted to like add more, they can just again browse for the medications here. And if at all any additional medications they want to send, they can select the medication and attach. And if at all they do not, they can remove it and add. If they wanted to, if the user wanted to send an additional medication, they can click this plus button again here and enter then and there itself and send if at all any information needed to be sent. Remove it for now. And shows social and medical history again. This, if at all it's relevant to the cardiology referral, they could select tick or untick. So this will only submit the ones which are ticked. I'll just select some here. Again, social histories, which is a free text field. So the user can populate, if at all they know additional information, they can free text this field as well, which will be sent as part of the referral. And all the patient information, as you can see, is auto-populated here, so that user does not need to enter any of these details. All the patient information here, next, anything recorded from the patient will be automatically populated here. And I've logged in as a test GP practice, user here. So as you can see, even the GP referral details are also auto-populated. So now I've completed all the sections. I could go and select submit. Once I select submit, it will give you a quick view of what is the referral has been submitted. As you can see, I've submitted a cardiology clinic referral for the Dubbo-based hospital, and this is all the patient information. This is the clinical information, as you can see, the reason for referral I've selected, and this is the supporting information. This is the referral details, additional referral details I've selected. And if there are any carer details, you should be able to see, and all the information whichever I've populated is shown in the HTML form. So this is how exactly the user will be in ERMS will be able to see the referral with the attachments. As you can see, all the medical history and everything has been attached. And if at all any attachments are added, they will be seen, and attachment images or anything added, they should be able to see in the ERMS application. So this is how a referral can be submitted from the GP software. That completes my demo.
Mm. So there's quite a few questions coming in. I'm not sure if Mark's still online. We'll get to those questions shortly. I'll just quickly talk. So, hello, sorry, I'll turn on my camera. My name's Adam Edwards, and lovely to meet you all, and thank you for coming along tonight. I'm with the eHealth team. I'm one of the change and adoption leads. I'm working on this program. I just wanted to talk quickly to this slide, and this is the slide of notifications that are sent out during the end-to-end referral process. So once the referral hits the LHD outpatient clinic, all the way through to when the triage outcome happens. And if you look at the left-hand column, you'll see that you get a notice at each of these points throughout the process. So once your referral or your patient's referral is sent across, you'll get a notification back saying that the referral's been received. If it moves to on hold for any reason, so for example, the outpatient clinic might be asking for additional information to be supplied, you'll get a notification then. If a message is sent back to you, if the screening outcome is not accepted, you'll get a notification. And at that point, if it's not accepted, your patient will also get a notification. What's important here is in one of the options, when you submit your referral, is you can elect your patient's preferred method of contact. So you can elect that contact as their mobile phone or as an email address. and that's how the information will be spread along to the patient. Again, if the referral's been redirected, your patient and yourself will get a notification. And then when the triage outcome happens, and I guess the stark contrast here is that when you look down the middle column and you look at paper type referrals and emails coming across, and non-e-referrals, this is what the pain that other GPs across the state that we've been working with have been talking about with the referral and the outpatient process, is that it's just this black box and you don't have visibility of where your referral's at. So this is just a really good message, you know, a good uplift. You should now, like, the way the e-referral system works is now it's trackable, it's traceable, it's reportable, and you'll have visibility of the referral end to end. There's quite a few questions coming up in the chat. I'm not sure what the next slide is. Oh, these are the notifications. Madhu, would you like to just talk through the notification types that come across, and at the end we'll look at those questions and answers?
Yep, sure, absolutely. So at the first stage, once a referral has been received, a user should be able to receive the referral, which is called referral receipt. So that indicates that this referral has been received from the received into the ERMS application, and we will, like, if at all any additional information, like, sorry, if at all once the referral is been screened and triaged, again the user should be able to receive the notification back. So first notification a GP will be receiving is a referral receipt. And if at all any additional information is needed, for example, if a referral is kept on hold here, which is a second screen you are seeing. So if at all a referral is kept on hold and additional information is needed, this is how the message will be sent back to the GP indicating what's required. So either an update could be sent or a referral could be sent with those additional information. And after the referral has been triaged, so Craig, if you could go to the next screen, please. So this is a referral triaged message. As you can see, if a referral has been triaged in the ERMS application, GP will receive a notification saying that the referral has been triaged, and this is the urgency of the referral which has been triaged. The triage category is either 30 days, 90 days. You should be able to see the triage category as well. So once the referral is been triaged, the GP will receive the notification. And there could be some scenarios where a duplicate might have been received, or a referral might have been received out of area, or the appropriate, like, not received to the right clinic. In those instances, if a referral is been cancelled, the GP should be able to receive a notification, like, as you can see, for example, patient might have contacted the hospital and said they no longer want to proceed with the care. So in those instances, the referrals will be cancelled and GP will receive the notification that the referral has been cancelled. Yeah, if you could go to the next screen, Craig. So this is how, like, as you can see, this is how GP should be able to see the notifications in the practice software. Yep, and Adam, can I hand over to you? So this is how the notifications are being sent and received.
Sure. Craig, why don't we go to the questions and answers? Oh, sorry. Here's the resources that are there. JC, would you like to talk about this? So JC is our partner from HealthLink.
Yeah, absolutely. Thanks, Adam. Yeah, getting started with HealthLink, just in relation to some of the questions coming through the chat, it's really important to note that you've all got access to these free resources that are available on the HealthLink website. So depending on the practice software that you use, we have shown you one version of that practice software tonight, but the same forms, the same flow, everything that has been put together in terms of those HealthLink smart forms work exactly the same across all those different softwares that you can see on the screen there, including if you even don't have one of those softwares and you need to access the My HealthLink portal, which is a web portal, web form service. The same smart form that we've shown you tonight exists in that same format to be able to send through to Dubbo Hospital in the first instance, to get those referrals securely through to that endpoint. In terms of receiving the notifications, because there was a couple of questions coming through as well, each practice software has their own workflow around how those notifications are handled. These are the same, but be comforted that this is the same way that you receive all your routine radiology and pathology and discharge summaries and other letters and correspondence that you get from external parties as well. So the notifications channel sits in exactly the same spot as per your particular practice software. There are some other web pages and other support that are available as well around the program itself. Ministry of Health has its own website, and the Western New South Wales PHN also has a website as well. So if you do have any more information, if you do need any more information about either health pathways or further supporting information around the referral program, those are your locations, including the HealthLink website. Again, that will be an anchor point for additional support, again, with your particular practice software or any enhancements that are being made to the overall project.
Cool.
I did want to just also touch, Adam, just around, I noticed Ivy, Dr. Ivy Chua wasn't here today to present, but certainly she was instrumental in helping co-design these forms. So over the last 12 months, these referral forms for New South Wales Health outpatient services, which, as we've presented, have been rolling out across various districts across the state, have been co-designed. So and Dr. Ivy was certainly one of those participants, with both referring health professionals and clinicians. So you can see they're quite comprehensive, just making sure that where possible, business rules are applied so that the efficiency is there when you first enter the form, but that standardization continues no matter what specialty you're referring to. So it's really important as you navigate and refer patients to different services that you don't have to deal with a different workflow in each particular form. The fields have all been standardized in a way that certainly the clinical content is different, but the aim is to make it a nice fluid process for you to learn and therefore consistent when you are having to refer patients to various different settings. And it's just important to note that these collaborative efforts with both referring practitioners and clinicians on New South Wales Health side have really ensured that user-friendly angle has been supported throughout, and most importantly, so that when those referrals are received into the ERMS, which Mark was pointing out earlier, there is a seamless process there around triage and handling those referrals without really having to manually handle any of that information as well. So I just wanted to touch on that. Yeah.
Just while you've got the floor, JC, because there's a few questions, and I'm not sure, it might be worthwhile. I don't know if everyone can read and see the questions. There's a few system questions that are coming through and a few policies type process questions, but just on the system questions, where it was answered in the chat, but where does the information auto-populate from? You talk about that one. When you're filling in the e-referral.
Yeah, so the e-referrals themselves in each of those practice softwares, you can't actually access, as Madhu showed in just one of the practice softwares in the demonstrations, the integration, the security of the integration, which is really important in this day and age, the security of that remains within the patient record that you're dealing with. So you can't actually get access to the e-referral solution without being deep inside the patient context, as we've demonstrated. So the fabric of the system works within the practice software environment, and obviously then deep within the patient record itself. So a lot of the knitting of all of the forms, the referral forms that we've shown, there's a lot of pre-population of data that comes through. So a lot of the patient demographics, a lot of the medical history, a lot of the medications and appropriate or relevant attachments that follow that patient around with information that you receive about that patient as well, can all be enclosed, can all be attached and added to your referral at your discretion, and that's really important as well around the co-design. there's not the pre-population goes to a certain level, and then it's up to you to declare what's appropriate for your patient to be referred on to the health service. So yeah, there's some control sort of bedded in like that.
And there's a great question here that talks about it's both a systems question and a process question. So JC and Joss, you both might want to comment on this. So will the referrals be rejected if they don't have all the investigations listed? And something that might be worth pointing out as well is there are required information types and required data types that are flagged throughout the form. It won't be rejected, but so per se, as much as it won't allow you to send for the referral until all of those data fields are populated. But in terms of rejection, JC and Joss, do you want to talk to that?
Yes, and for some specialties, there are certain criteria that need to be included within a referral to make it appropriate in order to be triaged. Some statewide referral criteria, for example, will be embedded in those forms for gastroenterology and ophthalmology, for example. Orthopedics as well will be embedded so that there is a clear understanding of what would be required to make that referral complete in order to be triaged. If there is any information that's required that is missing, though, it's the capacity to go back to the referrer to get that information is there within this system, which is an invaluable feature of that messaging from specialist to clinician to referrer, to get that information across to that patient care.
Yeah, that's right. I'll just add to that, Joss. Yeah, that's been a key component that eHealth and New South Wales Health have developed into the system. So the ability for both the outpatient clinic to discuss or request more information if they can't accept the referral. They do need to elicit more information from you as the referrer. So I guess from that angle, whether there's a rejection or an automatic rejection, that's probably not going to be the case. But to accept the referral, there might need to be that additional, request or consultation that needs to occur with you to ensure that you can provide that additional information.
That's
and
right.
that update, I think the update referral feature, which Madhu just explained at the top of the demonstration, would be where you will go to send an update following the receipt of those pieces of correspondence back from the outpatient clinic. Sorry, Joss.
No, that's right. I agree with you. And in the instance that there is a valid reason for a rejection, such as the service does not cater for that particular issue to hand, further information would be made available to the GPs as to where then that patient should go to receive appropriate care in those instances as well.
Sure. I guess continuing on the update referral kind of line of questioning, it's another systems question. So does the referral save automatically in best practice? So what happens after, I guess the question is for the other patient management softwares, so what happens after I send the referral if I'm a GP?
Yeah, so that referral does get saved automatically back into your patient software, as a referral would be if you didn't complete it as well. There is an autosave parked feature that exists within the form. So if you get busy throughout the day and you don't get a chance to complete that referral form before submitting it, and a copy will automatically be saved and parked against that patient record for you to fire up again later and send that off to the relevant location, a clinic, etc. So all these same features exist in the SmartForm system, so that you'd be familiar with that approach with sending any of those assessments out to Fitness to Drive for transport for New South Wales forms. So that Fitness to Drive medical assessment has these same features built into it as well.
And final, another system question. I'm not sure if we're scheduled to end at 7:45 or 8, so I'll just try and go quite fast. But when selecting the speciality in the form, is it automatically there in the drop-down boxes, or do the GPs need to manually enter which speciality? So remember when Madhu was selecting the speciality, they were there already listed, so they're in the drop-down box. ready for you to go. So every onboarded clinic should be in that drop-down box, ready for you to select. There's a few questions that have been answered in the chat, but I don't know if everyone can see the answers. So about emergency department referrals, Joss, do you want to just speak to what's happening there?
Yes, so the referral pathway to the emergency department or any patients that need to go to ED should be, the current pathway remains the same. Yeah, this is for outpatient specialist clinics only, for non-urgent care in that regard. I did mention if by chance any fracture referrals did come into the orthopedics clinic, we would address those as appropriate. So there's an exception for those referrals that do make it through, but anything else that really ought to go through the ED, the current pathway still stands for that, where you speak to the on-call clinician or registrar for that specialty and send them through to ED as appropriate.
Look,
I was going to say there's a few questions or comments in the chat which I'm happy to answer. Adam, if you want me to take over,
yeah, sure. Please go.
So the first one, I think Sue asked around if we have locums and they do a referral, where will it go when they leave? So stores back into the patient record. Every action as mentioned in your practice software will stay within your practice software. There is an option to print the referral once generated and submitted. What purpose does this serve? Purely a patient service. If you deem it appropriate to print that out and hand it to your patient, there's no obligation for you to do so. Both you will have a stored copy and the hospital will also have a copy of that exact replica of the referral. So it really depends if that's a necessary requirement for you or not. Does it go into unchecked results section of best practice? The notifications will go into your inbox, your incoming reports and letters area. So as it comes in, you'll do the appropriate actions against that particular notification, like your others. Locum referrals will be either triaged by appropriate specialty clinic. Oh, okay, that's Joss answering. Yep, sorry.
And we've got another question down there from Gary to say, if the clinic is no longer taking new patients, e.g. cardiology, neurology, rheumatology, will this come up at the beginning prior to completing the form, or will the e-referral not be an option? There is also clinic availability information around specialist availability and clinics through health pathways and information we send out to GPs as well. We are accepting cardiology referrals at the moment. We have 3 cardiologists here at the service able to take on new patients. Neurology and rheumatology both have limited capacity to accept any new patients at the moment, but that referral pathway is still open for continuation referrals. So any patients that are currently being seen in those clinics. So information regarding particular clinics should be referred to in health pathways or from clinic information as you refer into those services. This other question from Charlene: when working with only locums and they still send normal emails by fax, will they still be accepted? Yes, we will still accept referrals that aren't submitted online. They'll still be manually entered at this end, because there are some clinics that will not be able to, although we would like those locums to still access that e-referral pathway via HealthLink if that's a possibility through their practice software system.
And Joss, I just wanted to add to your comment there with Gary. In other areas, and it's likely going to come up occasionally in New South Wales LHDs as well, and the Dubbo Hospital, when circumstances change at the hospital where particular clinics cannot accept referrals for a period of time. As it does in the regions from time to time, there are control mechanisms in place so that e-referrals cannot be sent to that particular service. But as Joss said, there's going to be other communication support there that you'll get from your local health pathways and other colleagues as well.
I think Peter commented that he just wanted to say thank you. So thank you too, Peter. that's it. Craig, maybe do you want to share the final slide again, Craig? And Katie or Craig, do you want to close us out?
Yeah, absolutely. Craig, you jump in.
No, look, that's fine. Katie, thank you. No, look, I'd just very quickly like to say thank you to the PHN for hosting this webinar this evening. I'd like to obviously thank the presenters, but more importantly, everyone who's joined us online here this evening. Thank you for joining us and taking up your really valuable time on a Tuesday evening to join us all. So we really appreciate it.